Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Today our topic is Brucella prevention and control. We will discuss about a little bit introduction of Brucella. To our best knowledge in Pakistan, the first human brucellosis study was reported in 1979. We will discuss more about the Brucella status in KP in Pakistan. That brucellosis is an important contagious zoonotic disease of domestic livestock and wildlife caused by bacteria of the genus Brucella. Currently, it has been reported that among all provinces of Pakistan, the highest number of patients were reported from Punjab province, like 5.8 to 10.7% at hospital outdoor and 6.87 to 38.94% occupational exposed. And NKP province of Pakistan 2 to 36.4% at hospital outdoor. This study was reported in 2021. It's up to date study. Brucella melitensis primarily infects small ruminants, Brucella abortus large ruminants and wildlife. Brucellosis infects pigs and Brucella canis infects dogs. This is we also discussed in the previous lecture. Also sheep's, cattle's, dogs, these are the main reservoir for the Brucella species and it transmits to human. Brucellosis causes abortion in animal and fever, fatigue, and loss of fertility in humans. It also a cause of loss of fertility in humans. Brucella melitensis species infection affect approximately 4 lakh, more than 4 lakh humans annually, particularly in southern Europe, the Middle East, and Central Asia. And after rabies, brucellosis is the second most transmissible zoonotic disease worldwide. How it will transmit to human, we discuss also in the previous lecture, but here will be a short discussion. It will transmit to humans through eye conjunctiva by aerosol or fingers. A person handle animals and after this don't wash their hands properly, so there will be chances to transmit this zoonotic disease, and also from aerosols through a conjunctiva. And if generate the aerosols and a person inhale its aerosols, like the person slaughter in working in slaughterhouses and laboratory accidents, like a researcher works on the Brucella species, so there are more chances to infect the person. Veterinary manipulations. And the third one type of transmission is the ingestion. We have discussed more about that. If a person takes unpasteurized milk, there will be more chances to get this disease, brucellosis. And if a person take unpasteurized milk or dairy products, that will be contaminated fingers. And the fourth one mode of its transmission is the abraded skin. Like veterans and other workers have their skin cut, so they are directly exposed to the brucellosis. And how it will control and prevention. So the control individual who are occupationally exposed, like the veterans, researchers, and other workers, can be protected through some extent by wearing of the personal protective equipments like impermeable clothing, rubber boots, gloves, face masks, and goggles, and by practicing good personal hygiene. So that will be more helpful in the prevention. The second one is the pasteurization of milk for drinking and for incorporation into other dairy products is effective in protecting consumers. The third one, prevention, is no widely accepted vaccines for humans, but there are present some certain types of vaccine for the animals which we need to vaccinate our cattle and other animals on time. So, but progress in the understanding of Brucella epitopes and immunology could change this. However, eradication of brucellosis from domestic animal reduced dramatically the threat to human. If a person vaccinate his animals well on time, so there will be less chances to transmit the brucella from animal to humans, and also will be there will be no chances to infect the animal. An eradication campaign, the level of zoonotic disease can first be reduced by intensive use of live attenuated vaccine like the Brucella abortus strain 19 in cattle, Brucella melitensis strain 1 for sheep and goats, particularly in amateur animals. But when a person get exposed and got infected, so there are certain types of antibiotics present for Brucella. Therefore, the emphasis shift to the detection of the infected herds by skin test in sheep, serological test or milk, or blood sample take at sale of the slaughter and cattle. It means that there are certain types of the test available for the testing brucellosis in animals as well as in humans, like the by skin test and sheep and serological test like of blood will be taken for this test and this test will be performed after the taking serum, and another one test is from milk test or ring test is also called a ring test which perform directly from milk, and individual animals by serological test and to the elimination of litter by slaughters. So, if a person get positive test result, there will be start the antibiotic therapy. Humans are treated with the combination of antibiotics from 4 to 6 weeks, like doxycycline, rifampin form the basis, with the cotrimoxazole replacing doxycycline in children. But fewer relapses are reported with the regimen including 2 weeks of daily streptomycin. So thank you. Don't forget to watch about brucellosis awareness campaign. More videos. Don't forget the click the button, subscribe and share with your friends. Thank you very much for watching this video.